Welcome to RSSDI TV 2020. I am Dr. Sanjay Kamble, and on behalf of Wockhardt RSSDI TV 2020, I welcome you all. I am glad to have with us today a renowned endocrinologist from Bangalore, Dr. J Aravind. He is currently practicing at his private center, Dr. Aravinda's Diabetes Center, an integrated center which provides all facilities essential for a diabetes patient. He is the immediate past president of RSSDI Karnataka chapter. Welcome, Dr. Aravinda sir, to the show. Based on
Thank
your
you.
recent talks in RSSDI 2020, we would like to know what are the difficulties encountered in the clinical practice in controlling hyperglycemia with insulin therapy.
So insulin therapy is always a challenge to our patients. Whenever we initiate the insulin to a patient, the patient acceptance is a big difficulty. And understanding the insulin technique is also one of the issue. And always the injection fear is always there. So however, we convince the patient, educate the patient and give the insulin very well. But the problem we always face is once the insulin is started, that there are few challenges like patient not controlling with even on insulin, the patient will go on hyperglycemia. So because of so many issues, whether it may be a wrong technique, taking the injection inappropriately, there might be a reduction of dosage. All this leads to hyperglycemia. Sometimes it surprises everybody. How come the sugars are not controlled even when the patient is on insulin? So when we go into the depth of the issues, then we come to know there are so many issues with regards to patients dexterity, visual disturbances, technical issues, social issues, and all those things will be there. These are the problems we face when we try to control the sugar. And another, medically you see sometimes because of the severe insulin resistance also, sometimes even the dosage of insulin may not be sufficient. Sometimes we start with the basal insulin once a day, then we increase it to, if the sugars is not controlled, then we may change to premix, or if the final thing is we give the basal bolus therapy. So all these three modes of treatment we use, we come across various group of patient. One group of patient may be very well controlled with only simple basal insulin. Sometimes the premix insulin twice is okay. Very difficult patients are like we give the basal bolus patient, even then the sugars will not be controlled. These are the problems we face in controlling hyperglycemia when the patient is on insulin.
Thank you. So, sir, adverse events should one look at while initiating insulin?
Yeah, so that is the commonest thing that we should educate to our patient. One is the injection technique. If the injection technique is not good, if the patient is not taking injections correctly, there might be a local site reaction, redness, sometimes itching. And few times we see that insulin allergy is there, but it is very, very rare because we use the human insulin compared to earlier, like 30 years back, there were bovine insulin, which is however not available in the market. So we use only human insulin. So allergy chances are still less, but we have to keep it in mind. Sometimes few patients, like maybe 0.1 to 0.5% of the patient may have this insulin allergy. Then the patients may have lipoatrophy and lipohypertrophy can be seen when we give the patient with insulin. Mildly, there might be a mild bleeding chances if the patient is not taking properly, and may puncture the vein inadvertently. And most important side effect or things to be educated to our patient is regarding the hypoglycemia, that is the low sugar. So if you educate the patient about the symptoms of hypoglycemia and take the appropriate measures at the time, that will do the best.
So, how are these adverse events managed?
Yeah, so if adverse events like local injection site reaction is there, You just talk to the patient and tell what is happening, what is the technique he is using, whether his injection site is good, whether he is giving. Sometimes we see the patient taking injection at different areas where it is not recommended. So the insulin is not working at all. That may itself leads to hyperglycemia. So we thought that the patient is taking insulin, why sugar is not controlling? But there might be a inappropriate place of injection. That is the first point. If there is an injection site reaction, it might be we'll ask the patient to change the position of the injection site, or you may just give local antihistamines or a simple paracetamol if there is any mild reaction, which will take care of it. Next, the if there is an patient having hypotrophy and hypertrophy, depending upon the situation, then we ask the patient to shift the position of the injection. If the patient having some problem in the abdomen, where the fat muscles goes atrophied, then we ask them to change to the other side of the abdomen, or give in the thighs, or give in the arms, like this different areas will educate the patient to be taken. If the patient goes in for hypoglycemia, this is where the important is about the education takes place. We'll educate the patient about the symptoms of hypoglycemia, like giddiness, sweating, palpitation, uneasiness, restlessness, irritation, lastly unconsciousness. These things can happen if the patient going for hypoglycemia. So we educate them, and at that point of time we'll ask them to take the sugars or chocolates or sweets or sugar like fruit juices. So these things, if they take, that can be corrected and the complications can be avoided.
Sir. So thank you so much for sharing your views on controlling hyperglycemia with insulin therapy, and stay tuned to RSSDI TV 2020 for more recent updates from RSSDI. Thank you so much. Thank you, sir, for joining us.
Thank you.